Everything you need to know about atrial myxomas. They're defined as most common benign primary cardiac tumors, which typically occur in young adults between ages of 30 and 40 years, with slightly more prevalence in women. In majority of cases, the tumor will be localized in the left atrium, and other less common locations include right atrium or left ventricle. Since cardiac tumors are extremely rare, most of the patients who get atrial myxoma will have some accompanying genetic syndromes, such as cardiac complex. It is an autosomal dominant condition with very high predilection to endocrine and nervous tissue tumors, most commonly with peripheral schwannomas. And as you see in this image, the tumors arise from the interatrial septum and partially obstruct the blood flow from the left atrium into the left ventricle. Clinical features of atrial myxoma will be mostly caused by obstructive effects. So patients can get syncope, embolization. This stems from the fact that these tumors are actually motile, and so some part of the myxoma can break off and launch into the circulation, causing peripheral infarctions. A very important feature includes mid-diastolic rumble, which is a cardiac murmur very similar to mitral stenosis, which would also impede the blood flow from the left atrium into the left ventricle. However, in atrial myxomas, since we said the tumors are motile, the severity of the murmur could be changed by positioning the patient, where upright position causes worsening and lying position minimizes the obstruction. Constitutional symptoms such as fever, malaise stem from the fact that these tumor cells can produce cytokines such as interleukin-6. We diagnose atrial myxomas with echo, so both transesophageal and transthoracic versions can be used. And if we really want to specify the location and the size of the tumor, we can refer to cardiac MRI or CT scan, which would also help to evaluate for embolism risk. Management of the atrial myxoma obviously includes surgical resection. However, it is extremely important to note that even after removal of the tumor tissue, there is still risk of recurrence, so patients may require multiple of these procedures. And that's it for this topic. I hope this helps, and follow ConceptRx.